Dr. Linda Shuster, a faculty member in West Virginia University's Department of Speech Pathology and Audiology, is using advanced imaging equipment to examine speech at its source, the brain. On this day, Dr. Shuster is scanning the brain of a non-stroke volunteer using functional MRI at WVU's Center for Advanced Imaging.
The purpose of my research is to try to help people overcome speech and language disorders that they've acquired as a result of brain injuries such as stroke. One of the ways that I'm tackling that goal is to use functional neuroimaging to look at the way that the brain normally produces speech and language, and then we'll use those data to compare them to people who are recovering from speech and language, imaging their brains and looking at the patterns.
Dr. Shuster is also a certified speech-language pathologist who sees many stroke survivors at her WVU office. Around 19% of all stroke survivors suffer from some sort of language deficiency.
We know that experience using your brain changes the brain. The brain is what we call plastic. When we learn new information, we literally change the structure of our brain. And so in therapy, that's what we're doing. We're providing people with practice, but we still need more data on the kinds of practice, the amount of practice that causes those changes to happen more quickly, more effectively, and produces changes that carry over into people's everyday communication, their everyday life.